Assalamu alaikum and welcome back to Medic Hour. The first part of our show is very much looking at the topic of diabetes again, but today we've got Dr. Liz and our good friend Daphne in the seat, who's been talking about her life as a patient with diabetes. So we're looking at things from both perspectives today. Daphne, before the break we were talking about this situation you can find yourself in called a hypo, and you were describing those symptoms of how you know that your blood sugars are going really low and you really need to eat something. So do you mind just repeating what those symptoms were for you?
Yeah, for me, I often get angry, grumpy, not really angry, but just a bit irritable. That's often the first symptom for me. I know it's different for other people, but that's for me. And then I start getting a bit of a brain fog. What was I doing? What am I trying to, what am I thinking about? Yes, just confusion really. And it's at that point that I usually know to eat something. If I didn't, I would then go a bit faint and a bit shaky. And the next stage, as I found out only once, is to crash dramatically to the ground. But that has only ever happened to me once. And looking back on it, it was very easy to see why it happened. I was walking around a lake. As I say, I do a lot of walking. I'd had a bowl of porridge in the morning and an apple and a banana, which is a good breakfast. It was a 4-mile walk around Grimwith Reservoir, but halfway around it started to rain and it was colder than I'd expected because it's higher up and it's a bit colder. And again, that's not a problem to me, but obviously I was using up more calories and more glucose than I'd expected. So I said to Stephen, I think my blood sugar's getting a bit low. And because it was already lower than it should have been really, I ate a Kit Kat, which was a daft thing to eat. I should have gone straight for the glucose.
You could have eaten any other brand of chocolate.
Any other brands are available. So I ate some chocolate and it wasn't enough. It wasn't sugary enough. I should have gone straight for the glucose, which I always carry with me. And then I walked about another 30 yards and just thought, well, I can't stand up. But even then, I wasn't unconscious or anything. I was just, the glucose is in my pocket, and I just had the glucose. In 5 minutes, I was absolutely better and completed the rest of the walk with no problems. That's the only time I've ever had a proper hypo, and it taught me a lesson, which is don't mess around eating chocolate, eat the glucose. And
because that's a quicker way to build up the
The trouble is, if you eat chocolatey things, what happens is you eat the chocolate, it's in your tummy, but there's a lot of fat in chocolate, so it takes a long time to digest it. Whereas if you go straight for glucose, dextrose tablets, Lucozade, although you have to get the right strength of Lucozade, or even sugar, glucose, that will bring your blood sugar up very quickly. Jelly babies are really good. Jelly babies are literally liquid sugar, and as soon as you eat a jelly baby, it dissolves into sugar in your stomach, and it becomes it will immediately raise your blood glucose levels.
Very hard to get halal jelly babies, I have to tell you.
And the other reason I don't eat jelly babies is I like them, so I just quite
you wouldn't
stop. So that's not good.
So Daphne, tell me, I'd really like to hear about how you look after yourself as somebody with diabetes, because you've been through having tablets as a type 2, somebody with type 2 diabetes, but actually you don't have tablets now, you're on insulin. Do you mind telling us a bit more about not only your medication, but also what else you do to look after yourself?
Yes, well, a couple of, probably 3 years ago now, the tablets were really, all the different tablets gave me different side effects. And I eventually, in consultation with some excellent doctors, I decided to go on to insulin. And to me, I know that some people are very worried about needles and things like that. I wasn't, because when I was pregnant I had to inject myself with heparin, so I knew I could do those injections. And actually the insulin now is so easy.
Is that your pen?
This is my insulin pen, which I carry around all the time. That's the insulin. This one's about half empty. So I won't actually inject myself because I don't want to scare everyone.
We're at tea time
I'll show you what you do. You shake it to mix it a bit. You roll it to mix it a bit. Then this is me putting the needle on, and I'm not going to show the needle if anyone is worried.
Well, no, actually, can I say, I think you should let people see how tiny
it is. An absolutely tiny needle.
Because most people think the needle's this big.
No, it really isn't. Look at it.
I mean, can people see it?
It's absolutely
well, it's
tiny.
invisible to me from this distance.
It's tiny.
When you put it in, and I usually put it in around my abdomen area, I'm so blasé about it now. I can do it without looking. So there has been times I've done it under the restaurant table while carrying on a conversation, and nobody knows that that's what I'm doing. And
I guess the normal question from me would be, how painful is that?
It does not hurt.
It doesn't hurt at all because it's fine and small.
It doesn't even draw blood.
Oh, really?
No, it just goes in. It comes out. It really, it doesn't hurt. That's all I can say. Well, before having the insulin, I would always check my blood, and this is my meter for checking my blood. And you get these little test strips with it.
Yes.
And I think these are quite expensive, aren't they?
Yeah.
These are the expensive, this is where I cost the NHS money, but I have paid a lot of money into the NHS. So just to, I can demonstrate, there's the test strip. You put it into the meter like that.
Do you want to hold your meter up, perhaps, Daphne, because most people may never have seen a diabetes.
I don't know where if I'm
there you go, yes,
it
we
in
can
the right
see
way.
it there, yeah.
So, and when a little sort of drop appears, like a little drop of, which tells you it's ready to have the drop of blood. So what I do is I put, this is a little sort of, it's called a lancet that you use to get your blood. And
again, another small needle.
Another tiny, tiny needle.
But not as tiny as the injection.
No, it's absolutely tiny. So you put that on there, then use a finger. I use a different finger every time and I do this twice a day. And you just put it against your finger. There's the drop of blood.
Yes.
You see, I didn't even notice, did I?
And you've actually done it on air.
And I've done it on air. You put that against the end of the test strip, and it counts down. 5, 4, 3, 2, 1. Mine's going to be really high because I had something to eat just before I did this. 11.2, which is far too high, but that's because I've just eaten something. So it tells you that. Usually before I eat something it will be 5 point something, 6 point something, 7 point something, and that's kind of okay. And then I would give myself my insulin, having tested my blood. And
so you've just done that. Do you need to take insulin now that you know it's 11.2?
No, because I've just eaten something and it stays high for a while.
Okay.
It should be below 10. Is it a couple of hours after you eat or something like that?
Okay.
And it will go down. It's because I have just eaten and it's gone up.
Okay.
When my father was diagnosed with diabetes, in contrast, his blood sugar was 33, which is ridiculously high. And I'm convinced there are people walking about who have very, very, very high blood sugar and just don't know.
It would be, I mean, obviously if people don't know that they're dealing with diabetes yet, but they've had some of the symptoms, obviously we want people to go and check that out with their doctor. But for people who are dealing with diabetes as a health condition, what are the kind of numbers that they should be looking at as being considered to be in the safe ranges?
Well, first of all, I don't want to get us bogged down in numbers because everybody is different.
Yeah. Okay.
But we would generally say first thing in the morning, in other words, fasting, when you've not eaten anything overnight, a perfect number would be something like between 4 and 8.
Okay.
And then we know, just as Daphne said, if you've just eaten something, the food's gone into your tummy, it's then had chance to be digested, turned into glucose, the blood glucose level will go up. And ideally, we would like it to never go above 10 after a meal. Right. So 2 hours or so after a meal, we'd want it to be at the most 10, but coming down.
So Daphne's was 11 point something, and you consider that to be okay because she's just eaten and it's not 2 hours after yet.
Now, I've got to say, I don't have diabetes yet. My dad had diabetes and I got to keep an eye on my weight. So, you know, it might happen as I get older. But probably for me, because I can make enough insulin and because I hope that my meals don't contain too much carbohydrate, probably my blood sugar will never go as high as 10.
No.
Okay.
So it is a reflection that Dorothy, beg your pardon, Daphne, I've got a friend called Dorothy, that Daphne has diabetes, but it's not worrying me knowing that she's using the treatment. But I think something that might be worth explaining, Daphne, is everybody needs different amount of insulin, don't they? Yeah. Can you tell us how much insulin you use?
It comes in units. A unit is very tiny. When I first started, I thought, what is a unit? But I'll just show you. You dial the number of units you want. Again, I'm not going to inject myself, but I will show you. You just dial the number of units. The first thing you do is you dial it up to 2 just to check the insulin's ready, and you spray it into the air. And then you dial the number of units you want. And so I have 11 in the morning, so I would just dial it up to 11 and then stick it into me. And that's all you do. Press the little button and that's it. And then in the evening I have a bit more because I tend to have my main meal in the evening. So in the evening I have 17 units.
And everybody's different.
Everyone's different.
There's different sorts of insulin.
Yeah.
And of course it depends on the person.
Yes. Right.
So it depends on the sort of insulin, how high their blood glucose levels are. And when somebody's starting on insulin, we tailor-make the treatment for that person. So, for instance, Rubina, if you were going to have a new dress made at the tailor's, they would take measurements. How long are your arms? How big is your waist? How long? And then they would then make a dress and you'd try it on and see if it fitted and say, oh, this is a bit long, please could you shorten it? And I'd like a blue one, not a red one. And it's exactly the same. If somebody's going to go onto insulin, using the measurements we have, because they've been checking their blood glucose levels, just as Daphne has, at different times of the day, we can, from those figures, know how much insulin that person is going to need and also work out probably the best sort of insulin. So if your blood sugars are, like you mentioned, your dad's were in the 30s, he's going to need more insulin than Daphne, who we know had a blood glucose of 11 and sometimes only has a blood glucose of 5. So we tailor-make the treatment for each patient.
You sound, and it's obvious to me that you know quite a lot about your condition and how to look after yourself and you've learned how to use the medication so that you don't sound to me like you need a lot of help with it. How did you get to that stage?
I suppose I've always been quite interested in looking after my health properly. I thought if I'm going to do this, I want to do it properly. And I had some good explanations from doctors and other healthcare professionals. And I've just gradually picked it up along the way, really. And it's not that difficult. That's the other thing.
Something I would like to say, because I think Daphne is different from a lot of people.
She's really embraced it, hasn't she?
Motivated enough to go and do their homework and find out. You don't just get that information in your head. And there are a lot of educational programs. Now that sounds a bit stuffy. There are lots of programs designed to help people understand about diabetes, all the aspects of diabetes. Why does it matter the food you eat? Why does it matter the treatment? Why is exercise useful? What are the risks and the complications of diabetes? And different areas will have different programs to deliver the education. I come from Leeds, for instance, and we have something called the Leeds program, which is something which is a course, you could say, and takes 3 weeks. So somebody will go for 2 hours one Tuesday, and then the next Tuesday they'll go back for 2 hours, and the Tuesday after that they'll go back for another 2 hours. And the first session may have been explaining why diabetes is a serious problem and needs to be looked after properly. The next session may be talking about the right treatment, and the next session may be just people asking lots and lots of questions, so that at the end of the course they will feel as if they understand what their diabetes is and what they can do to look after themselves. Daphne is an expert at looking after Daphne's diabetes.
She is, I mean, it really does sound like you've embraced this, you've become an ambassador for this in some ways.
Yes, but at the same time, there are times I find it difficult, and one of those times is family celebrations, ironically. If I'm at a wedding or something like that, elderly relatives, a lot of elderly relatives, they want to look after you, and the way they want to look after you is with large pieces of chocolate cake. And I have no willpower. So there have been many occasions where somebody said, oh, come on, Daphne, one won't hurt. And it's, you don't want, I find it very difficult in the middle of a celebration to say, well, yeah, but it won't just be one. If I eat one, I'll eat 12.
Yeah, I don't think that's any different in our communities either. When we have celebrations and weddings, there's always nice sweet stuff going around, and I think we all show love through the dessert section of our meal.
And sometimes I will just go for it. Last week I was on holiday and I had desserts quite a bit, which I wouldn't do at home, but I did them actually in the knowledge that I was going to walk about 3 miles after dinner, so I thought, well, I'll work this off. And that's probably not ideal. I wouldn't do it all the time, but I think sometimes you have to live your life as well.
I have to agree there, Dorothy. Why do I keep saying Dorothy? Daphne, I have to agree. I think what you're really saying is, I know I have to have a sensible diet, but there are times in my life which are special and I will treat myself.
Yeah.
But I also, and I'm presuming, Daphne, you're back from your holiday now, you're saying no to the dessert.
Exactly.
You're saying no to all those pieces of chocolate cake. So it's lovely when your aged auntie gives you a piece of chocolate cake, and you can say, that's really lovely. Maybe I'll only eat half of that piece of chocolate cake, and it's a special occasion, and for the next week, you won't be going anywhere near any chocolate cake. So diabetes should not be seen as a punishment.
Okay.
We have to live with our diabetes, and we want Daphne and other people to be in control of their diabetes, and that's why knowledge puts you in control, and you understand, and it's not frightening. When you don't understand something, it's frightening. When you do,
you just have to take some simple precautions. My son, for my birthday, bought me a sea kayaking trip with him and with his girlfriend.
That's very adventurous.
I'd never been sea kayaking before, but of course I am very confident in the water, and I thought, this sounds like fun. And then I realised that Ollie was hiring these kayaks for 4 hours, and I thought, oh, I can't go 4 hours without having something to eat. And Ollie was kind of, oh, Mum, of course I've thought of that. No way I'm taking you away for 4 hours without food. And there was nowhere in the boat to stow anything really dry. So what we did was I had my glucose tablets, which are pretty waterproof, and then we got a whole little picnic, tied it up tight in a polythene bag and took it with us. And we rowed round to a beach a few little bays down. This was in South Wales. Absolutely beautiful day, where we had a picnic, and it was great. But I would not have felt safe, and I would not have been safe setting off in that kayak without some kind of glucose.
So you know your body and your symptoms and your what is necessary for you well enough now that you can plan ahead, you can think about how to prepare and still enjoy life, enjoy your holidays, go away for periods of time, away from where the normal stuff would be, like this little bay that you went to in the kayak. But you knew how to organise yourself so that you wouldn't be unsafe. And I guess this is the great message that you're giving to our viewers, is that at the end of the day, we have to decide as patients how much we need to take control of these things. And the way it sounds with you, Daphne, is that you've asked for information to guide you, you've learnt about your body and how it works, and you've actually taken responsibility and said, the best person to look after me is me.
Yeah, and I think that's a really good point, because I think in the past the sort of way medicine grew up was, I've got this wrong with me, what do I do, what does the doctor do to make it better? But for diabetes, it's not the doctor, you're the person who's with you all the time. So you've got to decide, you've got to decide and look after yourself. It's down to you.
And want to look after yourself.
And want to look after yourself. Because the trouble with, I suppose, type 2 diabetes is you can ignore it for quite a long time, just feeling tired and not brilliantly well. But then eventually you will get some horrible complications. And my poor dad had really bad leg ulcers. We haven't really talked about how you can get problems with feet and so on.
No, you're coming on to my next question.
Because you can get ulcers on your legs and your feet. And eventually these may not heal, and that's what happened to my dad. So they all kind of joined up in a hideous way, and at the age of 85 he had a leg amputated. He handled it brilliantly. He really coped well with it.
But that's such a dramatic thing to have to deal with. Yes.
And you have to know that is what I am aiming not to have, you know.
And this is what this whole conversation is about, really. It's about the fact that we need to take ownership, and we know there are risk factors. And I don't think we've talked much about risk factors, but you're certainly mentioning one about leg ulcers that can lead to serious things like amputation.
And you have to be careful. I have my feet checked every year. All people with diabetes are offered an annual foot check where they feel the pulses in your feet, and mine are always fine, and then they tickle your feet with a little sort of, I don't really know what to call it, just a little sort of prong that tickles your feet. That's all there is to it. Again, very simple.
What's that all about then?
Let me explain.
Yes.
Diabetes can affect the circulation. That's why we feel for a pulse. So just as we have a pulse in our wrist, we have a pulse in our foot. So part of the test is checking that the circulation is satisfactory in the foot. So we check the circulation, and then just as Daphne said, we also check to make sure that the nerves are working properly, because diabetes can also affect the nerves. And if the nerves are damaged, you don't feel things properly in your feet. So, for instance, you could stand on a sharp piece of glass, but you wouldn't feel any pain because the nerves aren't working. Well, obviously, if you stand on something sharp, you're going to do damage to your foot, but you wouldn't actually see it, would it? Because it's hidden under your foot. Do we look at the underside of our... We don't. So, if the nerves aren't working properly, you are at a very high risk of problems happening. So this is why it's so important to have those annual checks. And if there are problems, and people with diabetes are at an increased risk of having problems, we can, at an early stage, start to do something about it.
What are the other things that we need to be conscious of as if people are heading towards diabetes or they've got diabetes, in terms of what other areas of their health could suffer?
Well, diabetes, as we said, does have different complications, and just as it can damage the blood vessels taking blood into your feet, it can do damage to other blood vessels. So, for instance, if the blood vessels taking blood to your heart are damaged, then your heart is at risk. So people with diabetes do have an increased risk of having heart attacks. If the blood vessels taking blood into your brain are damaged, then you can have damage to your brain. Therefore, you are more at risk of strokes. So heart attacks and strokes are more likely to happen to people with diabetes, and if your diabetes is not well controlled, you are at a higher risk than somebody whose diabetes is well controlled. And the other thing we probably need to think about are people's kidneys. I think people understand that diabetes can affect people's kidneys. And again, it's working in the same way by causing damage to the blood vessels. So I would imagine, Daphne, when you go for your annual check, your yearly check, you're asked to bring a specimen of urine, and the nurse or the doctor can do a very simple check in the surgery by putting a special stick in the urine, and that will tell them if there's any sign that the kidneys are leaking and that protein is getting through into the urine. And we can also send urine to the hospital and have very delicate tests done to see if even a tiny bit of protein is leaking, which acts as a wake-up call that we need to be doing something else.
And I must say, I've always had those checks, and I have never had any problem, which is it's actually quite reassuring, as a matter of fact. And one thing they said to me when I was diagnosed is, but never walk in bare feet outside. And I was just kind of, there is no way you're stopping me walking in bare feet on the beach, because I love it. So I'm afraid I do still do that, but I always check for cuts. And actually, I have been very lucky in that I do seem to still heal fast.
But it's interesting that what you've really said, Daphne, is you're having your checks done, and when it's done, the test is showing that you can still feel with your feet.
Oh, absolutely.
So I mean, I'm still going to say you probably should be wearing something.
And I'm going to have to bring this conversation to an end, simply because we're coming right to the end of the programme, and I wanted to end with us having a tip from both of you as to what you think would be the best advice you'd give to our audience out there in relation to looking after themselves from a doctor's perspective and from a patient's perspective.
I think if I was going to, I'll start off if you don't mind, Daphne. I think I would like to say it's very important that people understand what they are living with. So if you have diabetes, I would take every opportunity to find out as much as you can, so that you are in charge and you understand, and therefore it's not frightening. You know what you have to cope with, and you can make decisions. You'll make decisions for yourself how much you are able to do.
Sure. And Daphne, from you?
For me, it's find some exercise that you like. For me, it's swimming. It might not be that for everyone. Walking is fine. And the thing that I didn't know was that, and this sounds so obvious, eating more healthily makes you feel better.
Yes, it does.
It sounds obvious,
yeah.
but until I really upped the amount of fruit and veg I was eating, and suddenly thought, do you know what? I actually feel healthier than I've ever felt.
And that in itself would motivate you to do more things, wouldn't
absolutely.
it? You've been a prime example of how the doctor-patient relationship really works well, and thank you ever so much for coming here and sharing your stories with me, particularly you, Daphne, because I know it's been your personal story.
No, it's
and
been
thank
a
you
pleasure.
again,
Pleasure.
Dr. Liz, for all the advice that you share.
Can I just say that Daphne is an excellent patient
She is.
because she is interested and motivated.
Yes.
And Daphne is taking responsibility for her diabetes.
Absolutely. And may we all take care of ourselves in the same way. I hope you found it really useful today. Inshallah, keep me in your du'as. Assalamu alaikum wa rahmatullahi wa barakatuhu.